Welcome back to the OHSU Effect Inside Health and Science at OHSU. This segment is dedicated to women's heart health, and for good reason. Heart disease is the leading cause of death for women in the United States. With me now on the OHSU Effect is the director of the Heart Disease in Women program, Dr. Diana Rinkovich. Good morning.
Good morning, Lacey.
Okay, tell me, what does heart disease entail?
The most common type of heart disease in women and men is a disorder of the heart blood vessels called coronary heart disease or coronary artery disease because it involves the coronary or heart vessels. Coronary heart disease is a condition in which plaque builds up on the inner wall of your coronary arteries. A plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. In women and men who have coronary heart disease, plaque usually builds up inside the heart large vessels, the coronary arteries, causing them to narrow. The plaque can affect the heart in two ways. First, over the years, as the plaque grows, it can narrow the coronary arteries, reducing the normal blood flow to the heart muscle. This is especially important when the requirements of oxygen of our heart increase, as it happens when we do physical activity. The narrowing of the vessels and the abnormal blood flow can lead to symptoms such as angina. Angina is the name used to describe chest pain or discomfort. This is a more chronic condition that allows us, in most cases, to do elective tests to make the diagnosis and plan a treatment. But an already existing plaque, small or large, can suddenly rupture, causing a blood clot to form on the plaque's surface. If the clot becomes large enough, it can completely block blood flow to part of the heart muscle. This is the most common cause of heart attack. In this condition, immediately opening of the affected vessel is necessary to prevent irreversible and sometimes extensive damage of the heart muscle. Coronary heart disease can lead to serious heart problems such as a heart attack, heart failure, irregular heartbeats called arrhythmias, and sudden cardiac death. What can differ between women and men is a disease called coronary microvascular disease, which is a heart disease that affects the very small vessels of the heart. Recently, studies have shown that women are more likely than men to have coronary microvascular dysfunction. In coronary microvascular dysfunction, the walls of the heart tiny arteries are damaged or diseased. The heart tiny arteries don't relax properly and can even tight when they should be open to allow more flow to the heart muscle, as it will be the case, for example, when we exercise. Many researchers think that the drop in estrogen levels in women during menopause, combined with traditional risk factors for heart disease, causes coronary microvascular dysfunction. Research are ongoing to learn more about coronary microvascular dysfunction and its causes. Standard tests for coronary heart disease don't always detect coronary microvascular dysfunction in women. As a result, women with this condition often are not diagnosed and continue to suffer from heart symptoms and not getting the right treatment.
What are the heart disease risk factors for women?
Although the traditional risk factors for coronary disease, such as high cholesterol, high blood pressure, diabetes, and obesity, affect women and men, other factors may play a bigger role in the development of heart disease in women. For example, metabolic syndrome and combination of fat around your abdomen, high blood pressure, high blood sugar, and high triglycerides has a greater impact on women than men. Mental stress and depression affect women's heart more than men's. Depression makes it difficult to maintain a healthy lifestyle and follow recommended treatment. Smoking is very bad for women and men, but studies have shown that it's greater risk factor for heart disease in women than men. Low level of estrogen after menopause poses a significant risk factor for developing cardiovascular disease in the smaller blood vessels. Small vessels heart disease, as we said at the very beginning of our conversation.
Should only older women be worried about heart disease or all ages?
For women, age becomes a risk factor at 55. women who have gone through early menopause, either naturally or because they have had their ovaries removed, are twice as likely to develop heart disease as women of the same age who have not yet gone through menopause. Middle age is a time when women tend to develop other risk factors for heart disease. Women under the age of 65 who have a family history of heart disease should pay particular close attention to the heart disease risk factors. Women of all ages should take heart disease seriously.
How can we reduce our risk of heart disease?
It's important to know that heart disease is a preventable disease, and although there are some risk factors that we cannot control, like our family history and age, we have the power to prevent heart disease. It starts by learning our own personal risk factor and by making healthy changes in our diet, physical activity, and other daily habits. We can greatly reduce the risk of developing heart-related problems. Even if you already have heart disease, you can take steps to lessen its severity. There are several lifestyle changes you can make to reduce your risk of heart disease. Exercise 30 to 60 minutes a day on most days of the week, maintain a healthy weight, quit or don't start smoking, eat a diet that is low in saturated fat, cholesterol, and salt.
So what are the most common misconceptions about women's heart health?
Well, as you said at the very beginning, heart disease is the number one killer of women all ages in the United States. And those are the surprising facts. 1 in 4 women in the United States dies of heart disease, while 1 in 30 dies of breast cancer. 23% of women will die within 1 year after having a heart attack. Within 6 years, about 46% of women become disabled with heart failure. 2/3 of women that had a heart attack fail to make a full recovery. Once a woman reaches menopause, her risk of heart disease and heart attack jumps dramatically. 1 in 8 women between the age of 45 and 64 has some form of heart disease, and this increased to 1 in 4 women over 65.
That's Dr. Diana Rinkovich, the director of the Heart Disease in Women program up at OHSU. Coming up next, the 2 doctors who run the OHSU Sleep Disorders program. That's next on the OHSU Effect.